Minister Steve Brine.
Thanks, Mr. McKay. And thank you for chairing our session today. Let me add my congratulations to the member for Lincoln for securing the debate and the Honourable Lady from Crewe and Nantwich for leading us off today. Breast cancer sadly affects so many of us so personally. It's always a privilege to respond to any debate in this House, especially on cancer and especially on breast cancer. It's been a constructive and small and perfectly formed debate. It's always a pleasure to follow my shadow and my friend from Washington and Sunderland West. I think it is the first time a debate has been led actually by all three chairs of the same all-party group speaking for their respective parties. It was very important to us when we chaired the group that we had the three main parties in the chair, and we did that with then the Liberal Democrats, remember them, who had the third chair, and it was... Stop it. It was a real pleasure when the lady for Central Ayrshire joined the House that she came on board and took that seat. So let me just start by saying happy BCAM, because there is much to celebrate, as people have said, and it is Breast Cancer Awareness Month, or BCAM for short. And I pay tribute to all the people who are here. The survivorship is very important, and all the people who've gone. And there's such a heartfelt campaign that has been around. Macmillan did it earlier this year around, a mum with cancer is still a mum. And I think that's one of the best pieces of advertising in the health space I've seen for a long time. And, what I want to say is, the reason I say happy BCAM is because even the people who've gone, they were, while they were going through their challenges, they were still a mum, they were still a daughter, and they were still a sister, and that's very, very important. And even if children who lose their battle to cancer, who are only on this earth for a matter of days, they still left an indelible mark because they were only here for a few days. And it's very important to me that we always remember that, and I always do. So the title of today's debate is The Future of Breast Cancer. And the lady for Washington Sunderland West did say to me once when we were in one of our group meetings that you will be cancer minister one day, and if she could predict something else great for me, that would be excellent. Chancellor, she's already said today. Yeah, not sure about that one. But to be the cancer minister. I want a future where there's no breast cancer. I think the member for Strangford mentioned that, didn't he? And in fact, I think all the members who've made contributions this afternoon would like to see a future where there's no breast cancer. And one day perhaps, but the statistics show that we're making good progress, which is why I said there are things to celebrate, and we're ensuring that more people than ever survive breast cancer. 10-year survival rates, as has been said, have almost doubled from 40-odd% to almost 80% in the last 40 years. So, let me just begin by saying, even though I hope I don't need to say this, that cancer is the priority for me, and the Prime Minister chose to make it a centre point of her party conference speech this month. There was a reason for that, because it's a huge priority for her, it's a huge priority for her government. And survival rates have never been higher, Mr. McKay, and they've been increasing year on year. And of course, that's why the Prime Minister celebrates that, but it's also why she announced a rather ambitious, very ambitious package of measures for cancer care and treatment, showing that cancer will be absolutely central to the long-term plan for the NHS, of which I will say more later, and of which she has challenged NHS England to write this year, before the end of this year. We are committed to investing an extra £20 billion a year in our NHS, and the investment will build on the success we've already achieved through implementation of the cancer strategy for England. And I pay tribute to Harpal Kumar and those at CR UK who put that strategy together. We will build on that legacy, and we will take it forward into the long-term plan. The lady from Crewe and Nantwich opening today's debate raised a number of very good points, and she talked about, as did a number of people, but she raised it first, about secondary breast cancer data and collection. So She's absolutely right, Mr. McCabe, that the robust and timely collection and sharing of data is vital for improvements in breast cancer service. If we don't measure it, we don't know, and if we don't know, we can't act. So the National Cancer Registration and the Analysis Service, the NCRAS, as it's called, they collect data on all cancers diagnosed in England, with the data collection specified by the Cancer Outcomes and Services data set. So that data collection of secondary breast cancers, Mr. McCabe, was mandated as part of the COSND for diagnoses from April 2013 onwards. I remember with my shadow taking a delegation to see Prime Minister David Cameron in Number 10 to talk about this exact issue just before Christmas. I remember our photo by the tree. So it is good that that happened, and it's evident from comparing the collected data to sources in academic literature. The large proportion of cases are not being reported still in the COSD, and that is of great frustration to me. So NCRAS continues to work with NHS Trust to improve the completion of this data, and we've redesigned aspects of COSD to allow more relevant information on recurrence to be captured. But I don't for 1 minute shirk that there is more to do in this area, and I assure the House and colleagues that I will constantly and do constantly redouble my efforts in this regard. She also talked about... Yeah.
I touched on, obviously, the quality improvement project that we started in 2000 in Scotland, which was actually looking at many measures right along the pathway that the patient went through, that in essence was assessing the whole team and how the team functioned, what the surgery was like, what the diagnosis was like, what the chemotherapy was like. And the problem is there hasn't been that sort of audit happening other than for screening patients in England for quite some time. And while I totally welcome collecting data on secondary cancer, we really need the ability to have that units can look at their performance on patients first time around to try and prevent that secondary cancer. Yeah,
no, she's right, and that's why the COSD, as I say it for short, but the cancer outcomes and services data set, and it's not specific to breast cancer, and nor should it be, because of course there are sadly lots of different cancers. But she's absolutely right that it should be measuring and judging and analysing the outcomes and the services that lead to that outcome. And as ever, she's dead right. The point was made about the off-patent drugs and they're being found effective in new uses. So the Prime Minister has set out, and she said it in her party conference speech, and she said it when we were launching the new long-term plan ambition, how a key ambition of the NHS LTP will be to speed up access to groundbreaking treatments with a quicker translation of new breakthroughs into practice through investment in world-leading cancer research centres. And we hope and we believe that will speed up access to groundbreaking treatments with quicker translation into practice. Although biophosphonates, I always struggle with that word, are not licensed for the treatment or prevention of secondary breast cancer, clinicians can, of course, prescribe them off-licence or off-label, subject to local funding policies if they consider them to be clinically appropriate for an individual. And I know that she raised that point. She was right to. The other point that she talked about, not at the moment, I won't. The other point she talked about was about the long-term funding of cancer alliances, and a number of people in the debate mentioned that today. So, NHS England and I are absolutely committed to the cancer alliances. We backed them with significant funding. We will continue to fully support them to develop and ensure they've got the funding that they need to at least, the very least, what they currently have in this cycle to transform cancer service in the long run. I take a very, very close and continued interest in the cancer alliances, as members would expect. Just this week, I sat down with Callie Palmer, who's my National Cancer Director, to do what I would call a deep dive, to go through each cancer alliance in England. I want to know who runs them. I want to know where there are leadership challenges. I want to know where they're struggling to meet 62-day and why. And I want to know what turnaround plan they've got for that, including where people are not performing, we need to replace them. We wouldn't accept poor performance in a trust, and we don't. We don't expect poor performance, and we don't tolerate it in schools. And the cancer alliances are spending a lot of public money, and they should not be treated any differently. So I want to see much greater transparency to the cancer alliances. If I asked every member in the chamber today whether they have the name of their local health trust chief executive, and I would suggest that they would, and probably like me, they would have them on speed dial. if I asked members whether they have the name and number of the person who leads their Cancer Alliance, I doubt that would be the case. And I can assure members that that is going to change. Let me give way to that lady again.
Thank the Minister for giving way yet again. It was really around the issue of bisphosphonates and other off-patent drugs are old drugs. So these are usually drugs that ought to be cheaper and ought to therefore be very cost-effective. The Minister and indeed one of the other members mentioned these drugs are not relicensed. We actually had a private member's bill here, November 16, which unfortunately it was the Minister of the time who talked out to precisely set up a method of relicensing drugs for a new purpose. Now, we have got agreement that these drugs will go into the British National Formulary, which will hopefully increase their use. But I notice the shocking increase in prices of off-patent drugs that led to the NHS medical cost bill last year hasn't changed. The regulations are not being used. We are seeing NHS England being charged ridiculous prices for old drugs and ridiculous prices for specials that are made up for individuals. And I wonder, why are we not using the legislation we brought in to drive down those prices so that maybe all women in England could access drugs that are not actually that expensive, or shouldn't be?
There's so much more I want to get on to, Mr. McCabe. I'm sure you want me to get on to, so I won't go into any great detail. I will give her a note on it, but I know that my team within the drugs team that I work with, Lord O'Shaughnessy, who speaks on health in the other place, are working on the implementation of that legislation. I know she's asked me about this before, and it is incredibly frustrating to me that it isn't being implemented quicker, but that shouldn't be taken as any indication of lack of desire on our part to do that. But I take her point, and it is still right. I think that those prescribing decisions are for clinicians taken into account. But when I say about wanting to get breakthrough drugs quicker onto the market instead of staying in the Cancer Drugs Fund, we in breast cancer have good examples where that has happened, and we want to see that happen much more quickly. Now, my honourable friend, my dear honourable friend from Bexhill and Battle spoke personally and passionately, as he always does, about these matters, and I thank him for that. So he lots of things he raised, but he spoke about screening programme. So look, the breast cancer screening programme, Mr. McCabe, is a critical tool, and everyone has said this, to ensure that we catch breast cancers as early as possible, where there is a higher chance of successful treatment. But we know there's much more to do to improve uptake. In her party conference speech, the Prime Minister again set out that we will transform our screening programmes, making them more accessible and easier to use, and utilising the best research and technology. Further detail on that will be set out in the long-term plan later this year. He talked about technology, didn't he? He asked about technology in screening. So, yeah, in the future, it is very much our aim that patients will be able to make much greater use of technology to be informed of things such as GP appointments, such as screening appointments, rather than relying on the Royal Mail. And I'll come on to the screening scandal in a moment. But our NHS app, which is being piloted at the moment, will be rolled out from December this year. And I think that's just the start of the technology revolution that we want to see, and that this Secretary of State has made as one of his priorities. So we expect the independent breast screening inquiry to make recommendations in this area, actually. And a number of people asked about the inquiry into the breast screening problems that we had. We expect that to report very shortly. I don't have an expect date, but a number of people, I think the lady from Central Ayrshire asked me whether that is on schedule, and my shadow asked me that. Yes, I believe it is on schedule. I look forward very much. When you've got somebody as serious as the Chief Executive of Macmillan as part of leading that review alongside others, I know that it will challenge us, and it's meant to challenge us. The former Secretary of State set it up to do that. And also, the member from Bexhill and Battle talked about early diagnosis and mentioned the importance of that. So, I'm very proud of Be Clear on Cancer campaign that I'm responsible for through Public Health England. So in February and March of this year, PHE ran its 14th Be Clear on Cancer campaign, which focused on breast cancer in women aged over 70, which is a subject very close to our heart in the all-party group. And research shows that women are more likely to delay presenting to their GP with breast cancer symptoms. So the campaign previously ran in 2014 and in 2015, and the evaluation showed an increased awareness of the key messages that it promoted. And even more importantly, there were also more cancers diagnosed during the campaign period. So Be Clear on Cancer is something I'm very proud of, and I very much look forward to the next. We're doing Blood in P at the moment. We have all the glamorous things, Mr. McCabe, in my portfolio, but Be Clear on Cancer will be going forward and going from strength to strength. Now, the lady from Lincoln... Yeah.
Thank you very much.
Thank you, Minister. I'm incredibly impressed with what he said so far. Will you keep an open mind on the age limits in terms of screening? I think particularly in terms of the entry point. I know that it's been dropped, but will you keep an open mind as to whether it should be reduced to a younger age?
I always keep an open mind, Mr. McCabe. But look, the truth is, and the lady from Central Ocean knows exactly what I'm going to say here, is that the screening review will, I don't doubt, make recommendations about that. But there is very, very heated and divided debate within the breast cancer community around screening. And I put a full stop after screening. Not just at the age. We already have the Age X, the age extension trial, which is pushed up and pushed down to broaden the range at which we screen. But there is absolutely no consensus within the breast cancer community around the benefit of screening. And that debate does continue and does rage very strongly. And it's for us policymakers to listen to all the different views. And that's one of the things that the screening review will do. Now, a number of people, Mr. McCabe, have mentioned CNSs and the workforce, and it's something that my shadow mentioned rightly. So last December, Health Education England published its first ever cancer workforce plan, committing to the expansion of capacity and skills in fighting the big C. Well, let me just make some of the point. This includes an ambition to attract qualified people back to the NHS through domestic and international recruitment. HE also plan to expand the number of clinical nurse specialists and develop clear CNS competencies and routes into training. This will see every breast cancer patient having access to a CNS or other support worker by 2021. We are committed to ensuring this. Do come in. We are committed to everyone has an access to the CNS, as I said, by 21. We completely accept, I saw a lot of news coverage last weekend, that we've still got more to do on access to CNS, but I've been very interested in listening, because part of these debates is not just about me sitting here waiting to read out my speech. I think these debates inform me as much as anything, and I was very interested in the discussion that went on between the Labour and the SNP front bench around what you call CNSs and the MDT that they could be part of that offers that support to women as they're going through that journey. And I will definitely take that away, and at this point I will give way to the lady from Lincoln.
Thank you. Can I just ask you to respond directly to my comments? The figures out this morning, and I do know because I was given these and asked to comment on them, the numbers of people training to be a nurse have dropped by over 30%, just over 30% now, since the bursaries were withdrawn. And I know the government talk about associate nurses and apprentice nurses, but there isn't the take-up for those posts, and an apprentice nurse takes 4 years to train. So will you respond to my comment directly about, and of course it doesn't just affect nurses, it's radiographers as well, as I said.
Well, the general point I would say, and as you talked about, people can't live on goodwill; they have to live on pay rise. So that's why I'm very pleased that we have lift the public sector pay cap, and the significant pay rise that will be coming is welcome. So I would say, as well as expanding the nurse training places by 5,170, we are expanding the skills of specialist cancer nurses. There are 52,000 nurses in the NHS training, with more to come thanks to our 25% increase in training places. The debate around bursaries is very live. It is discussed every single time we have health questions. I dare to say it will be again on Tuesday, but the government has been very clear about its vision for the health education workforce and where we see nurse training places and the nurse apprenticeship scheme sitting in that. And that's probably all I can add at the moment on that. I do want to touch on so many other different things. So the lady from Central Ayrshire and my shadow and everyone else who's spoken has talked about prevention, and this, of course, is a debate called the future of breast cancer. So, yeah, we need to do a lot more to prevent people from developing cancer, not just breast cancer, but cancer in the first place. So as the Minister responsible for public health and cancer, I know that encouraging people to live healthier lifestyles can be one of the most effective ways to prevent cancer. And, you know, yes, there have been challenging budgets since we took office in 2010. I would refuse to bring politics into the cancer debate. But all I would say is that governments do have to live in their means. Governments don't have any money. Governments only have our constituents' money. We are spending £16 billion on the public health budget in England during this spending review period. But there have been difficult decisions made. I clearly cannot preempt the spending review next year. I know what the NHS is getting because we have preempted that ourselves, but we will make our announcements around the future of the public health grant that obviously comes through a different department to Department of Health in due course. But I want to just talk on this prevention point. So, you know, better prevention is not the silver bullet. I wish it was. You know, cancer is indiscriminately cruel, is the truth, and we've had statistics today around the number of cancers that are preventable versus, you know, sometimes 2/3 of cancers are just bad luck. That is a horrid fact of life, and it's a horrid fact of life that every member in this room lives with every day. And it can have devastating effects on children and people who've lived the healthiest of lives. But it can also, you know, it can have a huge impact and ensure more people live their lives free of cancer if we do focus on the prevention message. So obesity, and we talk a lot about child obesity, and the reason we do that is because obviously big children become big adults, and Cancer Research UK have been very, very good in this space and making the connection between obesity and cancer. When we made the connection between lung cancer, between smoking and lung cancer, it was a game changer. And I think CI UK making the connection between obesity and cancer. You know, I'm not fat shaming in saying that. It's just simply a matter of fact that obesity is a contributing factor to cancers. And, you know, 8% of breast cancer cases in 2015, I'm told, were the result of being too heavy. So we need to do better on obesity, and, you know, we could talk for hours about the child obesity strategy alone. There is, of course, diet. There is, of course, physical activity. And I was at the G20 early this month talking about strengthening health systems, talking about obesity and talking about physical activity. And everybody around the world concurs with that. And I would close on prevention, this prevention bit, and talking about alcohol, which the lady from Central Ayrshire mentioned. It is a big breast cancer risk, and that is the truth. And women that drink more alcohol have higher rates of breast cancer, and women who don't drink have a lower risk of breast cancer compared to those who do. So, you know, risk rises with alcohol consumption, and no particular level of intake is risk-free. That is the truth, Mr. McCabe. On the issue of the screening failure, which I just wanted to return to because the member for Strangford, who is in his place as always, God bless him, you know, we are, however well we're doing, we can't be complacent, and the screening figures are always something that I look at constantly and I constantly worry about. But, you know, the failing in the national breast screening programme in England, there are many things that come across your desk, Mr. McCabe, as a minister, which you wish didn't come across your desk. And there are many things that you lay awake and worry at night about. There are some things that kick you where you don't want to be kicked as a man. And the breast screening programme failure in England kicked me very hard there when that happened. So it resulted in thousands of women between 68 and 71 not being invited to their final screening. And that's a stark reminder that we think, however well we think we're doing, we've got to do better. So, you know, the former Secretary of State apologised unreservedly for it and said that, you know, all we can do is put it right. And we are putting it right in terms of inviting people back for those screening. But we're determined to, the independent review was set up to investigate and report on the circumstances of breast screening failure. And that's expected to report shortly, as I said. But it will challenge us, and it will make very, very challenging recommendations, and I look forward to discussing that with members. The other thing I just wanted to say, Mr. McCabe, is that the 5-year survival for breast cancer is already 86%, as has been said. So I think there are some in the breast cancer community that worry that the long-term plan and the Prime Minister's new 75% early stage detection ambition for cancer means, well, therefore we have no ambition left for breast cancer. So the National Cancer Director and I discussed the long-term plan earlier this week. I was absolutely clear with her, and she agrees that our long-term ambitions covers all cancers, including breast cancer. The 75% 5-year survival aim is ambitious. There are lots of cancers that would love to be even remotely there, but it isn't the limit of our ambition. And so I want a future where there is no breast cancer, as I said earlier, and the NHS does well at diagnosing breast cancer, but it must do a lot better at preventing it. And we must continue until its 5-year survival figure is 100%. And I don't take that as a naive ambition. So I just wanted to make that point clear, because I know some of the breast cancer community are concerned about that. I just want to pay tribute as well to the work that is selflessly done by the people that will deliver the vision in the cancer strategy and the wider long-term plan. You know, obviously our doctors and nurses, they're at the sharp end, and I know visit them when I go out and about. They're the people behind the highest ever survival rates, not ministers. So, and I also want to add my thanks to the charities who I've enjoyed working with, Breakthrough, and then obviously they, with Campaign, became Breast Cancer Now, and I enjoy working with Delith and Baroness Morgan, Breast Cancer Now, and I enjoy working with Breast Cancer Care, and also Haven Breast Cancer, who I have a lot of time for Haven. They create havens to help women feel human and normal again after treatment, and they do a lot of good work. So, Mr. McCabe, NHS England and I, with the support of what I always called Team Cancer, are utterly committed to making the ambitions that we set out in our long-term plan and our new cancer strategy an absolute reality, and that will ensure that we take a huge leap forward over the next 10 years to a future where cancer has no future. Thank you.